Well, here we are again. We're going to begin or continue on with our kinesiology unit, and we are now in the muscles. So you have been doing a lot of memorization and moving of yourself and palpating to be able to find these structures and understand these structures. You will notice as we look at the location and the action of the muscles that the content from the previous two chapters, bones and joints, becomes relevant. All right, here we go. There's our book. And all right. So we are going to, oh, no wonder I can't see. Here we go. All right, down we go. And we are on chapter 9. Chapter 9, muscles. So guess what? There's multiple names for the same thing. There is no solid agreement on what that is, particularly with muscle attachment terminology. So you're going to see that there's multiple names for the same thing, and that's just the way it is. With bones and joints and muscles, a good learning strategy is labeling activities. So you can get on YouTube or you can get a coloring book or whatever. Now there's a feature in your fundamentals book called the anatomy coloring book. It's more of a web-based thing. So that might be something to take a look at. It's available through Evolve in the fundamentals text. Okay. Here's the overall structure and the physiology and how things work, the importance of the connective tissue, and then we go through each area in depth, kind of like we did with the joints, but more, there's a lot more visual activity here. And so let's get started. Chapter objectives, key terms, got to know them. Learning how to learn. We want to give the bone, joint, muscle content, the anatomy, the names of it, the locations of it, its due. We want to understand the language. We want to be able to speak that. We need to recognize it when we come across it. But I don't want you getting bogged down in this either. People can get overwhelmed with this. So this is something where you're going to continue this. We're actually starting this with you way at the beginning of your class. And when you're looking at this video now, we're more than halfway through the program. So these are not unique terms that you have never heard. So this becomes part of that repetition pattern. And do make use of the online course that goes with this. It's very helpful, the orange one, as well as all of the YouTube support videos. And I've also included some dissection videos that can help you see this together in instead of separated out in pieces like in the pictures. You can start to see how it's all compacted and together. Okay. You need to say these things, you know, these words, you need to say them out loud, even if you stumble over it. I've stumbled over words. It's just the way it is. There are days when I can pronounce something and then the next day I can't manage to get it out of my brain and out of my mouth, but I recognize it. I know what it is when I see it. So this is the beginning part here of some rationales around our confusion here. Some of the language is based in Latin and Greek, and some of it is German, and some of it has got some, it's evolved into the English form, and then we also have issues around muscle attachment terminology. Common is origin and insertion, but there's problems with that language, which will be explained as you read through this. Proximal and distal is what is actually recommended by the anatomists. This is another way to, these two right here, rises from and attaches to, or from and to. So usually the origin is the proximal attachment and the insertion is the distal attachment, but not really. Origin insertion terminology has to do with function and action. So the origin is the most stable, affixed, and the insertion is down by where the joint movement occurs. Usually the origin is more proximal and the distal is, the insertion is more distal, but not always. But the proximal attachment is always proximal. So this is based on location and this is based on function. So you can read through this. Language is an ongoing issue, both in the sciences as well as massage therapy. So it's going to change. It's going to continue to evolve and change, and there's a knowledge lag. So this origin insertion terminology that's been trying to convert over for many, many years, and it still hasn't occurred. So same with the massage related terminology based on the application of a mechanical force. And that is slowly changing, but you still may have to know multiple names. You don't know exactly on the MBLEX exam what resource the writer, the question writer is using. So it's so fun. Okay, this is the overview of the muscular system, and you want to think of the muscle as an organ, not as an individual isolated structure. Even though we might study them that way, they're not. They never interact alone. They're always connected to something else. The nervous system is essential. It is actually an endocrine that has endocrine structure to it. It's the body acts as a unit, and muscles are part of that. So muscles in general produce movement, stabilize, maintain posture, and then also it's part of the heat generation. I just mentioned that it's an endocrine organ, and then we have cardiac tissue, smooth tissue like in our intestinal system. Here are the general functions of the muscle, an activity for retention, and how they all interact, how all the body systems interact, and then types of muscle actions. These you need to have recall of. And then what we find sometimes is all of these muscles have a little bit of tension in them. Some of it is held within the shape according to the density and pliability of the connective tissue. Some of it has to do with the nervous system. But it's weird when we try to describe this. So is the tone increased? Maybe, maybe not. Maybe it's a density issue. Is it tight? Is it short? Is it taut? It can feel stiff and tight if there's increased fluid in there or the connective tissue is changed. It can feel tense or taut if it's being pulled long, kind of like the tension at the ends on a trampoline. It can also feel stiff and tight if it's in a shortened phase. So, another example of how the descriptors we use, I think, are inadequate, and we haven't decided as a profession what we're going to use. So that leads to this idea of having multiple names for the same thing. When muscles actions, they can do a few different things, just like you can do different things. You can go to work, you can clean the house, you can create art, you can play musical instrument, but it's still you. So these are the different actions. We've got isometric, isotonic, and then with isotonic, which means there's the actual movement, the muscle cells are moving back and forth and changing the lengthening or shortening of the structure. If it is shortening and pulling is a concentric action. And if it is lengthening while under tension, it acts to control the movement around the joint. Eccentric, concentric, eccentric. All muscles can perform isometric functions and the two isotonic functions. And it's here that we have the functional muscle units. So we have antagonists and agonists, that terminology and what they do. This talks about the action of the muscle fibers itself. Maybe isn't that interesting that even with all of our scientific advancements, we still don't know for sure, but there is sort of a consensus around the idea of the sliding filament theory on how down at a cellular level, there's proteins that cause the units to slide over, and then when they lift up, then the structures are able to slide apart. You will want to have a working knowledge of the structures in this figure. And here is that sliding filament theory and the all or none response. So again, this is the physiological action that seems most biologically plausible and understandable. The length tension relationship is interesting. These filaments, they have to be close enough together so that when signaled, the proteins are able to crawl across them and bring them together. But if they're too close together and it's a signal to contract, but they're already closer together, they can't produce any movement. So a short muscle can be weak or not able to act, just like a very long one. The fibers are too far apart to get that first initial connection so that they can crawl over each other. Muscles do not move without the nervous system. Resting muscle tone is that minimal amount of tautness provided by the nervous system, and as well as the soft tissue structures and fluid structures to maintain the shape and the density of the structure. So here is your physiology, and we're gonna interface here with a critical thinking question. And the a way of working yourself through a critical thinking process. And the challenge is, where is pain I rub? Why do you think that would be a valid therapeutic approach or not? So there are different types of muscle fibers, typically classified by the type of fuel used and how much oxygen or not having oxygen available. And then how does a muscle heal itself if it is injured? And it heals a little better than nerves, but not as good as other tissue like the skin. Most often, if there is a tear in a muscle structure, it will repair with connective tissue, which is non-functioning cells. So the movement in that area is going to be inhibited. It's going to be kind of like you're driving around down a road and you find the orange cones around that's marking off an area. Maybe there's a big pothole or something and it's marking that area off, and then you have to go around that area because that area is not functioning anymore. So it changes a little bit depending on how big of an area this is. That changes sometimes the angle of the pull or the intensity or magnitude of the pull, um, depending on where it's located and how big it is. If scar tissue comes in there and manages that. Now, massage cannot break up scar tissue. It can temporarily increase some of the pliability, and it can support more normal function around the area of the scar. Myostatic units are functional muscle groups. Everything works together. So you have a mover, and then you have a mover, bend, and then you have, so that mover is going to take you away from anatomical position, and then you have an opposing muscle, part of the functional muscle group, that's going to take you back. So in this movement, this is movement related. So this is always the bicep, this is always the tricep. Now, this bicep is going to function concentrically. It's going to shorten and pull and produce movement. And it is the agonist. So it's going to get shorter and produce a movement. The antagonist, the tricep, still has tone, still has a level of nervous system activity here, but instead of the fibers getting shorter and pulling, the fibers are getting longer, stabilizing the movement so that you're not just flailing, stabilizing the movement and allowing that movement to continue around the joint. Now they're going to switch roles. The tricep is going to become the agonist. It's going to contract concentrically. It's going to pull at the joint to produce the movement. The bicep is now going to be functioning eccentrically. It is functioning as an antagonist, and it's going to control and allow that movement to come out. Now, if both contract at the same time without allowing any movement, that's isometric. So it's shortening without movement production. That occurs functionally as a guarding response or a protective response around an area of injury. So it creates like a cast. The soft tissues around the area just go whoa, and the movement is limited. So muscle shapes make a difference as well. Um, if they are kind of long, they actually produce more movement because there's more shortening available than if they're built more like a triangle or a feather. A feather type muscle is going to not necessarily move something a very long distance, but it's going to produce a lot of power. The reflexes that we talked about in the nervous system chapters, the way they respond, the movement that is created under the nervous system stimulus is produced by the muscles. So we have to take a little bit of a review here of the stretch reflex, the tendon reflex, the flexor and cross extensor reflex, and various postural reflexes. So the eyes and the ears function with the postural muscles. They function with the anticipating movement. So if I'm turning my head to go a certain direction, all of my postural muscles and all of my movement muscles are preparing for what it takes to function isometrically to stabilize, concentrically to pull, eccentric to control and lengthen. Um, it may not actually happen, but they're all preparing to do that. And then when I actually make the movement, we get into the integrated function. And then when I come back, it's just the opposite. So if I want muscles to flex without them doing a lot of movement, actual joint movement, I can look down towards my uh, umbilicus, my belly button. I can look down without moving anything, but the flexors of my cervical area will start to activate. And then if I look back up over my head, these stop functioning concentrically as a uh, to pull my chin down. They start to function eccentrically as antagonists as the muscles in that bring my head back into extensors, the extensors back here, start to function concentrically, even though I didn't produce any movement. So that's kind of fun. We actually can use that therapeutically to when you learn how to do something called muscle energy techniques, where you uh, create or have the person, the client, create a very controlled muscle contraction. Okay, now we're going to delve into more of the fascia, because the fascia is what interconnects all of these things as well as the nervous system. So you're going to want to understand this. And these are some of the biomechanical laws that work on this. You won't be directly tested on this, but it's important to know uh, how the science influences, day-to-day activities. These different terms are important. I've used some of them already. And then the big understanding is how everything is connected to everything, and the various connective tissue types are uh, the structure that pulls all that together and creates the form. this picture right here is pretty intriguing. These long units that are like saran wrap wrapping around a sandwich, and inside the sandwich, you've got bread, two pieces of bread, and you've got some mayo, and you've got some mustard, and you've got an onion, and you got a tomato, and you have cheese, and and then another, maybe you've got some tuna fish, whatever, and it's each layer is there, and they're distinct. The layers are distinct, but they're also in a unit, and they're wrapped up in this connective tissue. Um, but but that connective tissue can continue and move up into another sandwich, another functional unit of muscle. But it has to link down into the bony structure, in order for it to not just slide off. So these dots right here, these blue dots, are where the these chains, these units, will dive down and firmly attach onto the structure. It's common around joints. And if you're thinking about where something might get a little too stiff or something, this would be areas that you might concentrate on with uh, a massage application like inhibitory pressure plus movement, or the term myofascial release. This might be the area that you will. These areas are places that you would concentrate your um, pressure, and then add in that passive tension, or have the client produce an active or passive movement. And it's all connected, and so it operates through tensegrity. And we also have similar interface that's driven more by the nervous system. We'll teach you those. They can be called muscle firing patterns, or they're a synergistic relationship here, and this explains that. All right, here's our summary. And then here's a nice practical application that takes us back to chapter 8, uses the various words here. Pay attention to those terms like densification. Where did I see that? Fibrosis, what those are. Densification happens. It's a stiffness. Fibrosis is a tissue change. That is where we start to get some reduction in function, and it often is triggered by an inflammatory response. So densification massage can kind of restore some pliability to that. If the tissues have come fibrotic, that's much harder to change. Okay, now I am not going to go through every single individual muscle. I would be here for 40 days, and you don't want to listen to me that long either. This is highly, just like the joints and the bones, a repetition, self-study, ongoing responsibility on your part. This section has worked really hard to give you concise and relevant information. So it talks about muscle shapes with their function. So muscles that are like tubes and go up and down are typically located on the front and back of the body. And they don't operate in the frontal plane. They operate on the sagittal plane. They provide flexion and extension. Muscles that are shaped like triangles um, function more in the frontal plane, and they produce adduction and abduction. So you can look at a muscle chart and you can make an educated guess on what the muscle does. And then muscles that are more horizontally oriented with the fibers, they tend to twist. So they'll internally or externally rotate. So if we look at this schematic right here, we can see an up and down muscle here. We can make an assumption that that is going to flex if it's in the front, and it'll extend if it's in the back. So here's another up and down muscle. Interestingly, because of the way our body skeletal structure changed for us to be bipedal, stand up on two legs, at the knee, on the front, this is going to be an extensor. And on the back, it's going to be a flexor of the knee. This is also, though, a flexor of the hip. So it's a flexor of the hip and an extensor of the knee. It crosses two joints, so it can do two things. The hamstrings do that too. They operate at the hip because of an attachment, but not very good. The extension part of the hip joint is related more to these gluteal muscles. And the movement wouldn't be very far because they're not up and down muscles. They're more on a diagonal muscles. But this hamstring group here is a flexor, a main flexor of the knee. So just by looking at the shape, you can get an idea of what its jobs are and where it's located. So if it's on the front and the back, and it's an up and down cylinder muscle, it's going to be a flexor. It's in the front, usually, not always, and an extensor on the back, usually, not always. If it's a triangular shaped muscle, it's more often to be on the side of the body. So it's going to function in the frontal plane, and it's going to produce adduction and abduction. And then muscles that go sideways like this, they tend to spin things around. So rotate, places that we can rotate, we might find those muscles that are more horizontal. Here's a view again of concentric, eccentric, and isometric. Here's all the different ways an individual muscle can be named. I've already talked to you about the attachment terminology. This is going to give you ideas about how you can actually palpate. So one of the things to remember is that a muscle is going to bunch up when it acts concentrically. So if you put your hand in the general location of a muscle and you have it actually shorten and pull, it will pop up and you will feel it. So this segment is organized by individual muscles are organized by body area. Each muscle has the name and the pronunciation, what it means, what its concentric action, eccentric, and isometric action is, this list of attachment terminology, the nerve, and then the functional muscle groups with synergist antagonists, and then where applicable, the tender/trigger point that will typically will refer common symptoms that the client would come in with. So this is going to talk to you about that little bit of controversy around tender trigger points. You know what? As for me, it's a way of formulating how I'm going to work in an area. So, okay. Then there is an activity which is going to ask you to draw the muscles, and that's a repetition activity, and use some coloring for it. So here we'll go through these muscles of the face and head, but you'll see that this is the exact pattern that is followed all the way through the body. So there's an atlas that shows you how the muscles are as a unit in the area, the best an atlas can do. And then we're going to get into individual muscles, and it's going to have a more of a schematic type drawing to it. There's the concentric action, the attachments, the insertion, the innervation, the synergists, the antagonists, the common trigger points, and the referred pain area. Same thing for another muscle structure in the area. And it'll just continue down. And I encourage you to work with these in functional units. So you're going to learn the muscles in this section of the face and skull, I think is what I called it. We'll get up here, and facial expression. All right. Work on these together. Understand the relationships. Massage of the face is actually can move right into the hypothalamus and the limbic system. It's very interesting because part of the feedback loop is, what are these muscles doing? And facial expression is a way of externalizing emotion. All right. And away you go. And now we're at another section. Sections that move the mouth. This would be pay attention to this. And then once you have done a closer study here, then you're going to want to go back up and look at the facial muscles again. And then all of these work on around the jaw and the face. Move the mouth. Move the lips and jaw. And that's a group with little segments in it. Now we're going to get into another action, another collection of muscles, still in the head region. These are the muscles of mastication, and down you go. So this continues on and on and on, and you're going to have classroom support with this. You're going to learn to massage regionally. There's tons of YouTube support. I've posted a lot of it. There are a variety of apps that you can download that will drill you on the muscles. So you're going to have the best way to do this is to use the textbook as your organizational and informational platform, but then you're going to want to move out of the textbook and use as many other resources as you can. Just remember that you might encounter multiple names for the same thing. So now we're into another region. This is muscles of the neck. All right. Let me stop the share for a minute. And we're going to go back to the textbook and use the table of contents. Whoop, 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 whoop. Share. Let's go back to the table of contents. There we go. And I want to take you down through that area. Now, this is a long chapter because of that very detailed information. And very few resources will give you as much information, especially around the idea of concentric, eccentric, isometric function, synergist, antagonist. Most don't do that. Most will just do attachments and the concentric action, but that's not how the body functions. All right. I want to get down to the pathology. So there's the mechanisms of disease there. And it goes through and tells you how the progression of the muscle skeletal joint system can develop. And then what are the typical massage interventions that we use to try to create the best optimal function that is possible, the medications, and then the specific disorders. So again, these conditions are able and likely to show up on the MBLEX exam. Now remember, there are only 100 questions on the MBLEX exam. So the content we have studied thus far could end up being 50,000 questions. So I don't know, and neither do you, which of this content is going to show up in a question. It's usually not a direct memorization, it's a recall. So if you see the word spasticity, you're going to have to kind of know what that means. But I don't know if you'll get a question on spasticity or not. You may end up with a question on a muscular dystrophy, or you might not end up with any pathological questions on the muscle system. Maybe they're going to be more on the nervous system. So you've got to have an ocean full of knowledge to be able to respond appropriately to a bushel basket full of questions. But that's never wasted. That knowledge accumulation throughout your studies, and then at graduation, and then your ongoing knowledge accumulation is always going to feed into your expertise in critical thinking and communication with other people. So it's never wasted just because it may or may not show up on that exam. Okay, you know the drill here. We've got the summary, the critical thinking, and then the multiple choice questions. Now I'm going to pause here for a minute and get the online course up, because just as with the joints, the way that online course is presented is very reinforcing and very helpful in the study. So remember, at the end of every chapter, you've got the chapter test that you do. That's long, lots of questions. And for the online course, you've got a short test that you do that's 25 questions. Just want to keep reminding you of that. So let's look at the muscles of the lower limb here as an example. It has an introduction. It gives you the surface anatomy and a picture to look at, different visuals than you had before. Again, different figures than what you've had before. And it takes you layer by layer by layer through an area. So gives you some visuals on dissection of the area. And gives you functional examples of these happen to be muscles that go horizontal. So they internally and externally rotate the hip joint. It I have access to so many pictures, and so this is a transverse section through the body so that you can see the layers. This is the spinal cord here, but you can see how the various muscles look if you've cut the body in an up and down, or not an up and down, in a top and a bottom through the transverse plane. You can see how the muscles are organized. These would be vessels. This is the superficial fascia and skin. That's the actual hip bone and the muscles around it. These figures are not in the book. So this gives you an idea of how all the attachments lay up. Gives you some activities. Gives you a lateral view. So it really, really expands the information that's available in the textbook. Now, these activities may not work. Don't worry about it. This is the whole medial side. And then it's going to layer up. Let's see if this one works. Yep. There's how these muscles, another view of how the muscles of the limbs start to attach into the muscle of the torso and the pelvis. Here's layer 2. This is a very interesting view of I think this is a frontal cut. And here is the head of the femur and the greater trochanter. This would be the gluteus, the gluteal muscles. And this is the hamstrings that come up and the adductors. And this is the skin and then the superficial fascia. And the numbers here will give you the bony landmarks and the names of the structures. Let's see if this palpation one works. Yeah, shows you where to palpate for the gluteus medius, finger placement and action. And then it brings you into a level of massage application with it. So this is going to send you through these transverse planes. So when we massage the area, we're starting at the skin and then moving down through these areas. So a light pressure is going to just change the shape of the skin and the superficial fascia. It's going to take a moderate pressure to get down to the first layer of muscle tissue here, and then it's going to take even more pressure to get down into the deeper structures closer to the bone. And this is viewing it with the client is in the supine position. And then we're going to have even more and more of these images that you can take a look at, these dissection images and where they come from. So there is a lot of helps, a lot of visuals, and a lot of connection for how the muscle connective tissue bone joint organization is, and then how we can superimpose that on how we massage. So really pay attention to this on your online course. So there you go. This is going to be something that you're going to work with over time, and just be patient and keep working with the language, and you'll get it. It just is not something that comes immediate. So, ta-da, there we go.